Acute retropharynge abscess. Most patients are children below 3 years of age. Sources of infection. Suppuration of retropharyngeal lymph nodes occur secondary. 2. Infection in the adenoids, nasopharynx, posterior nasal. Sinuses or nasal cavity. Penetrating injury of posterior pharyngeal wall or cervical. Esophagus. Petricitis due to acute mastoiditis. Clinical features. Dysphagia and airway obstruction, stridor, are prominent. Symptoms because abscess obstructs the air and food. Passages. Croupy cough may be present. Torticollis. Stiff neck and extended head. Unilateral bulging in posterior pharyngeal wall on one side of the midline. Diagnosis. X-ray soft tissue neck lateral view. Shows widening of prevertebral space and presence of gas. CT scan. Figure 5 shows CT scan neck axial section of retropharyngeal abscess. Treatment. Medical. Systemic intravenous antibiotics. Incision and drainage of abscess. Rupture of abscess may occur during intubation. Child is kept in supine and head low position. A vertical incision is made in the most fluctuant area of the abscess on the lateral part of the posterior pharyngeal wall. Suction must be ready and handy to prevent aspiration of pus. Tracheostomy. In cases of a large abscess causing airway obstruction and laryngeal edema. Chronic retropharyngeal abscess or prevertebral space abscess. It is common in adults and rare in children below 3 years of age. Sources of infection. The tubercular infection of prevertebral space can occur due to caries of cervical spine, Pott's spine. It presents swelling in the midline of posterior pharyngeal wall because the infection is behind the prevertebral fascia. Tuberculosis of retropharyngeal lymph nodes. It occurs due to tuberculosis of the deep cervical nodes. It presents swelling on the side of the midline as the infection is in the retropharyngeal space. Clinical features. Mild discomfort in throat and dysphagia. Posterior pharyngeal wall. Fluctuant swelling centrally or on one side of midline. Cervical tuberculous lymph nodes. Diagnosis. X-ray cervical spines. Shows caries of the cervical spine. Treatment. Medical. Full course of antitubercular therapy. Incision and drainage of abscess. A vertical incision is made along the anterior border for low abscess or posterior border for high abscess of sternocleidomastoid muscle.